When the state of California wanted to create a 5-year strategic plan to guide their work to address HIV, hepatitis C, and sexually transmitted infections, there wasn't a clear way to approach it. We were starting this planning work in early 2021, and on top of years and years of difficult, often thankless work trying to prevent or treat HIV, hepatitis C, syphilis, gonorrhea, and chlamydia, most people had also been working in emergency response positions for the COVID pandemic for months and months, with simply no breaks at all. Everyone was overworked, depleted, and anxious to return to normal in the workplace, but fearful that would never be possible as someone working in a public health department. Sound familiar to anyone here? Yeah, I thought so. So we started to talk about what was needed to really move the needle in a new fundamental way when it came to HIV, Hep C, and STIs in California. We've had so many advances in the last decade when it comes to HIV, Hep C, and STIs. Today we have pre-exposure prophylaxis, or PrEP, a daily pill people can take that's remarkably effective at preventing HIV infection. We also have easy-to-take pills that can cure chronic hepatitis C in 12 weeks in almost everyone who starts the regimen, with hardly any side effects at all. We have federal endorsement of syringe services programs after so many years of these programs being forced to operate underground, which means we can do so much more to support the health and wellness of people who use drugs. But you don't have to have a PhD in epidemiology when looking at the data in California, like in the rest of the country, to see that not everyone is benefiting equitably from these advances. Black folks especially bear the most disproportionate burden of disease by far, whether we're talking about HIV, Hep C, or any of the STIs. If already living with any of these diseases, their health outcomes are far worse than people of other races too. The same is true for people who are incarcerated, people who are unhoused, people who inject drugs, and of course there's a lot of overlap between these categories of folks. So the group talked about this. We realized we were at a fork in the road, and we decided it was not acceptable to shrug and say, yeah, yet again, Black people don't do as well. That's just how it is. Instead, we said, why is this? Really, why? What can we do differently? And right away, everyone named the obvious things we all already know in public health: the housing crisis, systemic racism, a lack of accessible, supportive mental health services and substance use treatment and support, stigma and discrimination, a fractured and dysfunctional healthcare system, poverty. So we decided to look head-on at these issues and started to toy with the idea of organizing the state strategic plan to address HIV, Hep C, and STIs around social determinants of health. What if, instead of an HIV chapter, a Hep C chapter, and an STI chapter, or a prevention chapter, a care chapter, and a surveillance chapter, we had a chapter on racial equity, a chapter on economic justice, and a chapter on housing first? When the 25-person work group talked about this, most were initially resistant to the approach, especially with the COVID-19 pandemic raging. With everything already on my plate, now I'm supposed to solve racism too, said one. Another chimed in, or homelessness? There are people who work full-time on the housing crisis. My job is to prevent HIV infections. These are totally reasonable concerns. But through much continued discussion and debate, eventually the work group recognized that if we truly want to improve health equity, making sure that all Californians can benefit equally from the incredible advances in HIV, Hep C, and STI care and treatment in the last decade, then it is our jobs to focus on the social determinants of health too. We can't just shrug and say, yeah, we know these things are important. They're some of the most important things. But they're not something we can solve, so we'll just talk about other things instead, things that are more clearly in our job description. So now you're probably saying to yourself, sure, I buy this. It matters, I have to do something. But good luck. Have fun trying to address the housing crisis in San Francisco while getting yelled at for trying to take steps to protect people from COVID-19, while you're handing out sterile syringes on a street corner and talking to people about the new Hep C treatments that are available. That'll be great. All right, I get it. I'm here to provide a few tips, tricks, and inspiration for you as you continue on this journey, learned from our work with folks who do HIV, Hep C, and STI work in California and are on this journey too. First, we have to have direct conversations about the difficult issues, like racism. A lot of people, especially white people, don't want to even say the word racism at work. It feels scary. It feels like you're going to get in trouble, either in official trouble for saying something inappropriate, or unofficial trouble by finding yourself in a really uncomfortable conversation with coworkers that might make it hard to get through the day or sleep well at night. Well, being a Black person, Indigenous person, or other person of color in this country means often finding it hard to get through the day or sleep well at night. That's not a good excuse. Even when white folks do everything they can all day long to not be racist, we're swimming in racist soup here. The structures around us are racist. People of color experience worse treatment and higher rates of physical and mental stress than white folks from the time they're born, including when they go to the doctor, or show up at a public health program, or oftentimes when they go outside their house and try to exercise or find healthy food to eat. So if we're not willing to have difficult conversations at work about racism in the US and the way it negatively impacts the people we're trying to serve in our public health programs, whether those are HIV programs, diabetes programs, or substance use programs, we're only working on half of the story. We're always going to serve white folks better and see white folks do better than folks of color. We can't pretend otherwise. We have to have these conversations. Second, it's all about partnerships. You don't need to solve the housing crisis while you're talking to people about Hep C treatments. You need to recognize that someone who is unhoused, living on the streets, and worrying about their backpack being stolen, or shopping cart of belongings being trashed by the Department of Public Works because they went to a doctor's appointment, that person doesn't have a great chance at taking a simple pill for 12 weeks and actually being cured of hepatitis C. It's possible. Unhoused folks are successful at this all the time, but the cards are stacked against them. So if we care about eliminating hepatitis C, we have to figure out what resources are available and how we can work differently with other partners in our area to help make it more possible for folks to get temporary housing while they're being treated for Hep C. Or at least set up a system where they can access a medication locker to keep their pills secure if they're living on the streets. We have to put these types of new partnerships at the forefront of our work. Think about how to work together with new people to transform the experience that others have when they interact with our public health systems. And third, connections matter. Whether you work in the jails or in health education or in a medical clinic or in a partner organization not specifically focused on public health, we all got into this work for the same reason. We care about something. We feel inspired to make the world a better place in some way. And especially when people really care deeply about the work they do every day, one of the main ways to fight burnout when things get hard, and let's be real, they've been really hard lately, is to try to make sure people feel like they have a place at the table and a meaningful role in solving whatever problem they care about. If we take steps in our workplaces to remember that we're all full people with feelings and emotions and a desire to belong, be inspired, and find common ground with our colleagues and new partners, that can be fuel for the work. And this connections part is so important because you need the connections and the trust to have difficult conversations about things like racism. And the connections help bridge different cultures, both ethnic cultures and people from different disciplines you might want to work with in partnership. When you've taken the time to build connections, people don't shut down right away, especially when things get hard. All right, my time here is almost up. I'll just leave you with a bit of inspiration. We're making this paradigm shift in California, a huge state that's diverse in geography, ethnicity, and politics. We're in the process of rolling out our new strategic plan to address HIV, Hep C, and STIs throughout the state, with a focus on people who've largely been left behind as we've made these incredible health advances. We've done it with chapters on racial equity, housing first, health access for all, mental health and substance use, economic justice, and stigma-free. And as we've disseminated this plan to thousands of people at the local level, and really talked with folks about what it looks like to implement the strategies in this plan locally, initial skepticism has turned to enthusiasm. So what path will you choose? You can reframe your work in this way too. You have to, if you really want to make a sea change in the patterns of health inequities that continue to persist in our communities. I'd love to talk about this with you more. You can get in touch with me at the contact info in this QR code, and you can download a copy of the strategic plan at this code too. Or stop by the Facente Consulting booth here, booth 108, over there by the back wall, and come pick up a hard copy and say hi. Thanks for your time today.